In my presentation, I'm going to be talking about young onset dementia and the basic facts that are very important to understand. Okay, so who does this affect? It affects people of the working age, meaning between ages 30 and 65, and it can also be referred to as early onset dementia or presenile dementia, but most commonly you hear young onset dementia or working age dementia. Young onset dementia provides information that can spike new research ideas that can be used to study dementia in the elderly. So, young onset dementia is actually a lot less common in younger people under the age of 65 than dementia in people over the age of 65. So, studying the causes of dementia in people between ages 30 and 65 can provide very beneficial information to create future studies that can work towards getting a cure or more treatment available. So there's 4 major causes of young onset. They include Alzheimer's disease, vascular dementia, frontotemporal dementia, and autoimmune dementia. And the picture I chose, I thought did a great job representing how common each of these causes are and what causes are more prevalent as opposed to others. So it's noted that Alzheimer's disease is 34%, vascular dementia is 18%, frontotemporal lobar degeneration is 12%, dementia with Lewy bodies is 7%, alcoholic dementia is 10%, and other is 19%. I didn't really touch base on alcoholic dementia or dementia with Lewy bodies. I focused more on autoimmune dementia. So to start, Alzheimer's disease is the most common cause of young onset because it's characterized by having difficulties with memory. And obviously when you think of dementia, you think of having memory difficulties. A cure does not currently exist, but there are treatments that are available for symptomatic relief. There's currently 5 FDA-approved treatments available, which are all prescription drugs, and 3 of the 5 medications available are from a class of drugs called cholinesterase inhibitors, and they can improve performance with memory and thinking, which is obviously very important, which can work towards improving their quality of life. And although Alzheimer's disease is more common in people over the age of 65, it is also present in people of the working age. So seeing young onset dementia in younger patients provides information for scientists to conduct research towards finding a cure. And I thought choosing this image would be good because it shows the gradual degradation of the brain that occurs in patients that have Alzheimer's. So as you can see, the healthy brain, nothing wrong with it. And then mild Alzheimer's, it's slowly starting to degrade. And then severe Alzheimer's can typically be over a fast period of time, but the brain starts to be in very bad condition. Next, I have vascular dementia, which is the second most common cause of young onset dementia, and it is caused by a stroke. And people who have vascular dementia present with symptoms of difficulty with judgment, planning, and sequencing. Treatment is available if this form of dementia is diagnosed early, and the treatments available are aimed towards preventing another stroke. There's great medications that enhance cognition, and therapy is used for rehabilitation for vascular dementia patients. And I chose this image because I thought it did a great job explaining the visual of vascular dementia, because the concept can be kind of difficult to comprehend. As it shows, there's part of the brain that has a blood clot in the blood vessel, and plaque that's blocking and restricting blood flow to that part of the brain, which is ultimately what causes the stroke and creates the vascular dementia. So the treatments available are obviously very important and very good for those patients, because if another stroke were to occur, they'd face even more dementia and higher risk. So the next is frontotemporal dementia, and it is the 3rd most common type, and it's actually the most aggressive form. So people with frontotemporal dementia present with symptoms including behavioral changes, changes in language, which include both difficulty finding words and using the wrong words. There is currently no cure available for frontotemporal dementia, but there is treatment available for symptomatic relief. So these treatments include antidepressant medications that can assist in reducing behavioral problems associated with frontotemporal dementia. and some SSRIs that have also been effective in some people. The image I chose compares what dementia looks like in both Alzheimer's and frontotemporal dementia. So as you can see, frontotemporal dementia affects the majority of both the frontal and temporal lobes, and in Alzheimer's it affects the lobes that are more in the back of the head, so the occipital and parietal lobes. Next, we have autoimmune dementia, which actually differs from other dementias because as the others deteriorate over time, autoimmune dementia has fluctuations in behavior and functioning. So this form of dementia only occurs in about 10% of patients, and it can potentially be cured if it is caught early enough and there is minimal brain damage. There's treatment options available for patients with autoimmune dementia, including using steroids and immunosuppressants. I couldn't find the greatest image that made sense to describe autoimmune dementia, but here's an interesting PET scan that shows prominent hypometabolism, which is obviously the root to autoimmune dementia. So after immunosuppressants or steroids are used, the scan should begin to look nothing like this, and meaning it looks a lot healthier. So there's actually underlying causes of young-onset dementia, and sometimes there's not for the elderly. So the younger the patient shows an onset of dementia, it's more likely for that patient to have a genetic or metabolic disease. So there can be many underlying conditions that can cause young-onset dementia, which actually leads to more discoveries relating how it can affect some elderly people and not others. So why do some people get dementia and others don't? What is the underlying cause of that? What can explain that? It's a lot more common for people with young onset dementia to have underlying conditions, so it can lead to further connections being made between young onset dementia and dementia in the elderly. This being said, it's also helpful to scientists understanding more complex causes of the disease that could have been overlooked before, because dementia is a very, very complicated disease to try to understand. And lastly, there is very strict criteria for diagnosis, and the criteria that needs to be met includes a patient with young onset will present with severe cognitive impairments that compromise occupational and social functioning, and the memory of the patient must be impaired. So it's more typical to require an impairment in the episodic memory for the criteria for diagnosis. And the young onset patients need to see a few specialists before being diagnosed. So typically they will see a consultant neurologist or a general adult psychiatrist. And it's actually really cool because there's genetic testing available if there's a strong family history of dementia as well. So it's nice that some people could just have a genetic test to see if they stand a higher risk of getting dementia than others that don't have a family history of dementia and it just strikes them. So that concludes my presentation on young onset dementia. Hope you enjoyed.